Hey guys, I'm Joe from Manhattan Spine Care. Today I'm going to show you some neutral stabilization exercises to help strengthen the core, strengthen the obliques, abdominals safely, whether you have disc issues or stenosis. We're going to stay in a neutral alignment. This way we're not compromising your back.
Alright guys, so the first exercise is called the Palloff Press. You're going to want to tie a band about chest height. It's okay if it's belly button height and tied to a doorknob. Next, what we're going to do is have our palms facing down on the band about shoulder width. And then we're going to walk the band out laterally. This way we're getting some good tension on the band. Tabitha's going to have a soft bend in her knees. Toes are in line, hips are back. And what she's going to do is press straight out. And what this exercise is doing is engaging the obliques safely in this neutral plane because the band wants to pull her back. So in that sense, it's kind of a counter-rotational movement and it's safely engaging the core. All right guys, our next exercise is the Quad Birddog. So we're going to start on all fours with wrists under shoulders, knees under hips, nice tight stomach, and eyes soft gaze down in between the hands. Then what we're going to do is lead opposite hand and opposite leg out, leading with the heel, engaging the glute at the peak of the movement, and then slowly meeting palm to knee under our waist, keeping the core tight. The trick here is to keep the waist square to the ground and lead the movement with the heel and try not to open up that hip. All right, guys, for the third exercise, we're going to go into a traditional plank. We're going to have the feet shoulder width apart, toes digging into the floor of the mat, elbows under shoulders. Forearms are parallel with palms facing down. We're going to then elevate the hips, driving up. Without sagging the lower back, we're going to engage the core by drawing the belly button in, having the chin tucked in, and maintaining this position. Notice how Tabitha's hips aren't sinking down. Everything's in line from lumbar spine to thoracic spine. Last but not least is the dying bug. If you've been in our office for lower back injuries, you've probably done this movement. We're going to start with our legs in the air, 90 degrees, tight stomach. If you do suffer from stenosis, we're going to have you pelvic tilt. So essentially what Tabitha's going to do is drive the small of her back into the floor. This way the back isn't arching and everything is neutral. From there, we're going to alternate heel taps to the floor, maintaining a tight core with a slow, steady rhythm, hinging at the waist. If you do not have stenosis, it's okay to arch a bit, but you still want to brace this position of a tight stomach, drawing everything into the midline of the abdominals.